You can look at both.
Okay.
And we're live.
Hi, I am Jen Angad. I am with the marketing department here at Henry Ford Allegiance, and today we are here with Dr. Brajesh Patel from Henry Ford Allegiance Michigan Heart Cardiology, and we're going to be talking about heart failure today.
Sure.
So, Dr. Patel, can you kind of tell us a little bit about what is heart failure?
Yeah, sure. So heart failure is a very complex disease. So generally it manifests as a because of structural and functional abnormalities of the heart is not able to pump enough blood to the body cells, and they have many symptoms.
Okay.
Roughly about 500,000 of cases are added, new cases of heart failure are added every year. So it is a pretty significant disease, both from a financial standpoint as well as healthcare standpoint.
Okay. Are there different types of heart failure?
Yes, there are. So in fact, there are two main kinds of heart failure. So one is we call systolic heart failure, meaning that the heart is not able to pump enough blood, and other kind is diastolic heart failure, which means to expand. So heart becomes too stiff and it doesn't expand well, and people have difficulty getting blood to the body because heart is not being filled well.
So how would a patient know if they have heart failure? What symptoms should we be looking out for?
Good question. So the most common symptoms people experience is shortness of breath, specifically when they're exerting, meaning doing something. Mm-hmm. They may also notice that their functional capacity or ability to do routine tasks may have gone down. Some people complain of just generalized fatigue and weakness. Many patients also complain of weight gain, not because of the dietary reasons, but fluid. And they notice swelling in their legs. Once we identify those symptoms, we categorize them into New York Heart classification. So it's like a grading system. So 1 being people generally don't get any symptoms with moderate effort or routine work. 4 being extremely symptomatic even at rest or with minimal amount of activities.
Great. So what should a patient do if they're noticing that they are experiencing these symptoms?
Yeah, so that is a great question. So once they think something is wrong, specifically with these symptoms, they should call their primary doctor. They may be able to triage them further with maybe some testing, or they can refer to us cardiologist for further guidance and management.
Okay. So what is the treatment for heart failure? So say it's been diagnosed, then what are the treatment options?
The first thing we talk about is prevention. So the best way to treat heart failure is by preventing it. So let's say patients hypertensive or have high blood pressure for a long period of time. First thing we want to do is to bring their blood pressure down and reassess them. But their treatment options are too many. We start with basically blood pressure medications, which overlaps with the heart failure medications as well. And then depending on staging, so I talk about the symptoms grading, but there are staging of the heart failure from A through D. A is that people are at risk, for example, those who are taking chemotherapies, or like I give an example of hypertensive patients. Those are stage A patients. Stage 4 patients, or stage D patients I should say, are people who have refractory heart failure, meaning that they don't respond to typical blood pressure or heart failure medication, I should say, and they require more advanced therapies. And we are able to provide some of the support here at Allegiance, and if not, then we can appropriately delegate patients to receive advanced therapies that sometimes require motorized, little motor sits in the heart and helps pump the blood.
Wow.
Yeah.
That's really great information.
Yeah, we came a long ways. Within a decade or two, the heart failure research and therapy made a huge stride. So we're
Wonderful.
pretty excited to live in this day and age.
Awesome. Well, thank you all for tuning in. We are going to be speaking with Dr. Patel again next week, so stay tuned again. Thank you so much for joining us and for sharing this valuable information.
Sure, no problem.
Thank you.
Thank you.